Welcome to Nazareth Hospital's Orthopedic Joint Replacement class. My name is Christopher Selgrath, and I'm one of the orthopedic surgeons here at Nazareth Hospital. I'm a board-certified, fellowship-trained joint replacement surgeon. I'm also the Chief of Orthopedics at Nazareth Hospital, and I welcome you. The joint replacement class is meant to give you an in-depth understanding and experience about what it's like to get a joint replaced. We're going to take you from beginning to end and answer all questions that you have. We have two incredible individuals, Angela and Laura, that are going to go through that process with you step by step to take the mystery out of what it's like to have a joint replaced. One of the frequently asked questions is, why do I need to go through this class? And my simple answer is preparation is key. The more we can prepare you for the joint replacement, the better off you're going to be. And when I say better off, that means less pain, quicker recovery, a quicker return to home, and a quicker return to normal function. We're going to get you out of the hospital, get you home, and get you back on the road to recovery quicker. And the science and the literature that we have studied shows that a joint replacement class is key to that function. So sit back and listen to Laura and listen to Angela, understand what's going to happen, ask questions if you have them, and I'll see you at the end of the presentation.
Hi, I'm Angela. I'm the orthopedic nurse navigator.
And I'm Laura. I'm the lead physical therapist here at the hospital.
And today we're just going to go over our total joint class and get you prepared for your upcoming surgery.
And we'll discuss how you will do with your physical and occupational therapist to prepare you to go home moving better than you were before.
So we start every meeting with a reflection. So, behold, I will bring to it health and healing, and I will heal them and reveal to them abundance of prosperity and security. So we'll just go over the objectives. This is what we're going to be talking about today. So our goal is to prepare you for your surgery, help you understand your role as an active participant in your recovery and your rehabilitation. So today we're going to discuss your upcoming procedure, including your pre-admission testing, the surgical procedure, and your hospital stay. We'll explain how to prevent any post-op complications and prepare you to take an active role in your discharge planning. So a little bit about Nazareth Hospital. So our nationally recognized award-winning programs at Nazareth Hospital deliver advanced, minimally invasive treatments from surgeons who will help you understand your options. We use an interdisciplinary approach here. So the doctors, the nurses, physical therapy, occupational therapy, we all work together during your stay here. Our goal is to return you to your normal activities, reduce your pain, and increase your mobility and independence. So I'm the orthopedic nurse navigator. So I will be following you throughout your hospital stay. I will call and meet with you prior to your surgery. I will see you the day of your surgery, help you if you have any questions with anything, and then I will meet with you again on day of discharge just to make sure you understand all your instructions and your follow-ups that you need. So pre-admission testing. So once your surgery is scheduled, an appointment will be made for your pre-admission testing. Your surgeon may ask for you to see your primary care physician and or your cardiologist before surgery.
Pre-admission testing. So when you come in, there will be free parking available at the main entrance of the hospital. Report to the information desk to sign in. After registration, you will be directed to various departments to complete your testing. You might go to the lab, EKG, or any further testing your physician orders.
During your pre-admission process, you will receive a phone call from the nurse practitioner who will complete your history and your physical. When they do call, just make sure you have a current list of any medications that you're taking or any medical conditions that you have. Once your pre-admission testing is completed, your case is reviewed by your surgeon and your personal plan of care is developed.
So let's talk about infection precautions before surgery. Dental clearance. Your surgeon may ask that you see a dentist prior to surgery to check and treat any dental or gum infections. And then pre-operative skin prep. Before surgery, you will need to wipe with a cleansing solution. You will receive the wipes and instructions during pre-admission testing. These wipes are used the night before and morning of surgery.
For home safety, it is important to make sure your home is safe before surgery. Some things that you may want to do are remove throw rugs, electrical cords, and any other clutter that may be in your home. Be aware of any uneven floors, lips in doorways, steps that you in between rooms, and be careful if you have any pets. Consider installing grab bars in your bathroom or any equipment that may need to be purchased prior to your surgery. If you have assistive devices that you have used in the past, I recommend taking them out, making sure that they're ready for you in your home. Any equipment that you need at discharge, we will work to help you order.
So the night before your surgery, please remember, do not eat or drink anything after midnight. This includes chewing gum or lozenges. Your surgeon may recommend a carbohydrate drink, so if so, just follow the protocol that you're given in the office. You may take some of your morning medications with a small sip of water prior to surgery, only if directed by the pre-admission testing nurse practitioner that you spoke to. Okay, so now it's the day of surgery.
Day of surgery. For your convenience, parking is available in the south entrance on Home Avenue. Report to the short procedure unit on the ground floor of the hospital at your scheduled time. Please bring a list of current medications and dosages. If you have an advance directive or a living will, we recommend bringing a copy, your pharmacy name and phone number, a list of allergies, and then you can bring toiletries, comfortable clothing, and comfortable shoes to wear. Please do not bring any valuables, but if you do feel the need, we can keep them securely with our security department.
So once you're in the short procedure unit, you're going to change into a hospital gown. You're going to review some paperwork with the nurses there. You may be given some pre-op medications if ordered by your surgeon. The nurse will start an IV in your arm. The surgeon will come in and meet with you and then mark the site of your surgery with a marker. So then you're going to go into the operating room. Anesthesia will administer a spinal anesthesia. A urinary catheter may be inserted, which drains urine from the bladder and is removed the day after surgery. The patient, you'll be prepped and draped by your surgeon, and your surgery will begin. So then once surgery is completed, you'll be transferred to the recovery room in your bed. Your vital signs will be checked frequently. Medications will be given for any pain. An x-ray will be taken just to make sure that everything is in place. And then once you were determined stable by anesthesia, you'll be transferred to the orthopedic unit, which is located on 2 North on the 2nd floor. So a little bit about the orthopedic unit, 2 North. So there are specially trained orthopedic nursing staff, large private rooms. You'll have a bedside commode and a rolling walker in your room to use. You'll receive ongoing education throughout your stay. And we do morning interdisciplinary rounds. So you'll meet with the medical physician and the resident. You'll meet with myself, the orthopedic nurse navigator. Also physical therapy, occupational therapy. And if need be, you'll also meet with our social worker, our case manager, and home care. So once you get up to 2 North, your nurse will instruct you on how to use some equipment there. So how to use your call light, your telephone, and your television. They'll go over the A-boot pumps that you're going to wear on your calves, and then your incentive spirometer, which helps move air through your lungs. It'll help prevent any pneumonia after surgery, and we do like if you perform it about 10 times an hour while you're awake. So a telemetry monitor will be placed to monitor your heart rate. It will be removed post-op day 1. A pulse ox is placed on your finger to monitor your oxygen levels. You will be started on a clear liquid diet to start, and then as long as you tolerate that, you'll be advanced to an appropriate diet. Out of bed to the chair, so do be prepared to get out of bed about 2 hours after arriving to 2 North.
So pain management. We will ask you to score your pain on a scale of 0 to 10. 0 is no pain, 10 is the worst pain you have ever felt. A multimodal pain management approach will be used, which means you will be receiving pain medication around the clock post-op. Please report increased pain to your nursing team, and everyone's pain is different.
So the different types of pain medications. So there is injections, which is used only on the day of and the day after surgery for severe pain. Most of your pain medicine will be oral, which is started on the day of surgery. It does last longer than IV pain medications, and it's very important to take on a regular basis so your pain doesn't get too severe. And then an ice bag. It's very simple, but it will help decrease swelling and help ease your pain as well.
Anticoagulation. These are medications that help prevent blood clots after surgery. Different providers use different types of anticoagulation. For example, aspirin, Arixa injections, Lovenox injections, and Eliquis. We will work with you so you feel comfortable going home on these medications.
If your orthopedic surgery was a total hip replacement, your orthopedic surgeon may recommend total hip precautions. These are 3 things the surgeon would like you to avoid while you're healing to prevent hip dislocation. The first thing is not crossing your legs over past midline. So, just no crossing your legs over. The second thing is no internal rotation or pigeon toeing. So turning your legs in, pointing your toes in. And the third thing is no bending past 90 degrees. So when you go to sit in a chair, you want to make sure that it's high enough that you won't bend past that 90-degree angle. You also want to avoid bending over to do things such as tying your shoes or bringing your leg up like this, so again, you won't pass that 90-degree angle. Physical and occupational therapy. The day of your surgery, you will receive your PT and OT evaluation. The therapist will come to your room and evaluate you at bedside. They will teach you and assist you with getting out of bed, transferring, and walking with a walker. They will also show you some simple exercises to start getting your muscles moving after your surgery. On post-op day 1, you will have physical and occupational therapy, and we will transfer you down to our second floor therapy gym. There you can work on going up and down the stairs, transferring in and out of the car, and performing your activities of daily living such as showering, getting dressed, and working in the kitchen. If you are here later in the day, we will see you for a second therapy session. PT and OT will assess your needs prior to your discharge. We will make recommendations for further treatment and recommend appropriate durable medical equipment such as walkers, canes, crutches, dressing equipment, and possible equipment for your bathroom. Outpatient therapy may be recommended after discharge. The facility that you would be required to go to may be predetermined by your health insurance, and many of these facilities do also offer van services to assist with transportation. Inpatient rehab. If PT and OT recommend that you need more therapy in an inpatient rehab, our social worker will meet and work with you to find the best match that also accepts your health insurance. Certain criteria must be met for an insurance company to approve continued inpatient rehab. And our goal is for all of our patients to be discharged home when medically stable. Exercises that we will give you to do to increase your strength and your range of motion include ankle pumps, so moving your feet up and down, tightening your quad muscles or your thigh muscles, tightening your buttocks muscles, heel slides, which means pulling your heel up towards your buttocks as far as you can. We will also have you do deep breathing exercises, such as holding for a count of 5 seconds and relaxing. Repeat this 10 times an hour while awake. This will help to prevent things like pneumonia and keep you from holding your breath during painful situations. And to reduce swelling, we recommend that you elevate the hip or knee above the heart 5 times a day for about 5 to 10 minutes.
Incision care. A surgical dressing will be removed per your physician's order, usually around 5 days post-op. You may shower with the dressing on. If you have staples, they will be removed 14 days after surgery, either by your surgeon in the office or by the home care nurse. Or your incision might be closed with regular sutures, which will be removed in the office, or absorbable sutures, which will dissolve on their own. No bathing in a tub, swimming in a pool, or soaking in a hot tub for at least 6 weeks post-op.
So discharge planning. So anticipate going home the day after surgery. Studies have shown that patients have better outcomes when they go home. Again, we will use that multidisciplinary team approach, and everyone has their own individualized discharge planning. Okay, so home care. So a home assessment may be completed prior to surgery. If needed, home care may be arranged. The services they provide are nursing, a home health aide, physical therapy, and occupational therapy. If it is determined that you need home care, a home care nursing representative will meet you before your discharge. You cannot have home care, though, if you're going to go to outpatient therapy. So once you're ready to be discharged, you will receive a detailed list of all the medications you were taking at home before your surgery. Your nurse will explain what medications to stop, to hold, or to continue to take. All new medications will be sent directly to your pharmacy. Your discharge instructions will be reviewed with you by your nurse, and all education and instructions will be placed in your discharge packet. We do recommend that you have transportation available for the day of discharge. So prior to your discharge, you will meet with me again, the orthopedic nurse navigator, to review your discharge instructions and to ensure all your questions are answered before going home. And a patient satisfaction survey will be given to you before your discharge. It just helps to ensure that we're providing excellent patient care. So this concludes the class with myself and Laura, and we're going to turn it over to Dr. Selgrath to finish out the rest of the class.
Welcome back, and thanks for participating in our joint replacement class. As you can tell, Angela and Laura are passionate about joint replacement and making you have the best experience as you can. Please know that everybody here at Nazareth Hospital is going to treat you like family and is going to take care of you every step of the way. If you have any questions, reach out to myself or your treating orthopedic surgeon, or reach out to Angela and Laura and we'll answer any questions that you have, because we're here to make the experience great for you and to take out any question or mystery about joint replacement surgery. Look forward to seeing you at the hospital, at the surgery, and remember, we're going to take great care of you.